Why are CFS exclusion criteria important for diagnosis? Imagine trying to solve a puzzle where many pieces look alike. That's what diagnosing chronic fatigue syndrome is like. Doctors need to carefully rule out other health issues before confirming a diagnosis. Because chronic fatigue syndrome is a diagnosis of exclusion, exclusion criteria are essential. They help ensure that the fatigue and other symptoms aren't caused by something else that can be treated or managed differently. Many health conditions can cause symptoms similar to those of chronic fatigue syndrome. For example, anemia, thyroid problems, diabetes, sleep disorders, depression, and anxiety can all lead to fatigue and cognitive issues. If these are not identified and treated, a person might be misdiagnosed with CFS. Exclusion criteria guide healthcare providers to look for and rule out these other causes through medical history, physical exams, and lab tests. Since there is no single lab test that confirms chronic fatigue syndrome, diagnosis depends on recognizing a pattern of symptoms and ruling out other conditions. This is why exclusion criteria are so important. They prevent misdiagnosis by making sure the fatigue isn't caused by a known medical or psychiatric illness. This way, doctors can be more confident that the symptoms are truly due to CFS. Excluding other causes also helps in providing the right treatment. For example, if fatigue is caused by hypothyroidism or sleep apnea, treating those conditions can often resolve the symptoms. Labeling someone with CFS when they actually have a treatable condition could delay proper care. Accurate diagnosis ensures patients get targeted treatment for their specific health issues. Exclusion criteria also support research efforts. When scientists study CFS, they want to look at a group of patients with similar underlying causes. Using strict exclusion criteria creates more uniform groups, which makes research findings more reliable. This helps us better understand what causes CFS and how to treat it. Major health organizations like the Centers for Disease Control and Prevention and the National Institute of Medicine include exclusion criteria in their diagnostic guidelines. They recommend ruling out medical conditions such as anemia, thyroid disease, sleep disorders, psychiatric illnesses, substance abuse, and neurological diseases before diagnosing CFS. This thorough process helps ensure the diagnosis is accurate and consistent across different healthcare settings. In practice, diagnosing CFS involves a detailed medical history, physical examination, and specific tests to identify red flags or signs of other illnesses. Only after these steps confirm that other causes are not responsible for the symptoms can a healthcare provider confidently diagnose CFS. This careful process is vital because it ensures patients receive the right care and avoids unnecessary treatments for conditions they do not have. In the end, exclusion criteria are crucial because they help distinguish CFS as a unique condition characterized by persistent, unexplained fatigue lasting at least 6 months, along with symptoms like post-exertional malaise, unrefreshing sleep, and cognitive difficulties. They help prevent misdiagnosis, guide appropriate treatment, and support meaningful research. Always remember, if you or someone you know is experiencing these symptoms, consulting a healthcare professional is essential to get a proper evaluation and personalized care.